COVID-19 is the most significant global healthcare crisis in a century. While the speed and scale of the pandemic and the response to it has been remarkable, the impacts and changes caused will be profound and long-lasting. In 2020, healthcare expenditure in Malaysia grew 6.9% year-on-year, with an estimated value of 63.1 billion ringgit Malaysia. In 2021, the growth is expected to accelerate to 9.6%, reaching 69.2 billion ringgit Malaysia. It has also been forecast that health expenditure to experience a 5-year compound annual growth rate of 7.6% in local currency terms and 8.9% in US dollar terms, reaching 91.1 billion ringgit Malaysia by 2025. Malaysia has some of the lowest medical fees in the world, some 40% lower than US and UK, with the government subsidizing up to 98% of healthcare costs. The country allocated 29 billion ringgit Malaysia, equals to 6.9 billion US dollar towards healthcare in 2019. This makes Malaysia as a potential health service hub in Asia, despite fierce competition from its more established neighbours in Singapore and Thailand. The private healthcare sector in the country is expected to capitalise on the currently low hospital bed to total population ratio (BPR) by expanding capacity to meet a higher demand for hospital beds. Overall, the local healthcare sector is expected to grow to Ringgit Malaysia 127 billion, equals to 30 billion in US dollar by 2027, fueled by increasing demand for healthcare services from an aging population, rising affluence, and increasing life expectancy.
Duo Pharma Biotech Group began with the establishment of Duo Pharma Sdn Bhd in 1978. Duo Pharma Biotech was incorporated in 2000 and it is today one of Malaysia's leading pharmaceutical companies listed on the main market of Bursa Malaysia Berhad. Duo Pharma Biotech core competencies in the pharmaceutical industry include manufacturing, research and development, and commercialization and marketing of over 300 generic drugs such as GEMS, Flavets, Provision, and Ufamol. In 2021, Duo Pharma Biotech Berhad share price from January to October seemed fluctuate. The company's share price had a declining trendline slope on their graph, and the slope kept showing a decline until the end of the October. Duo Pharma Biotech Berhad's beta trend demonstrate the market were highly volatile compared to the overall market. And we can see that it has a high drop and rise from January to May, and the huge decline in the first 3 months in 2021 of the beta is because of impact. Duo Pharma signed a deal with the Malaysian government to supply Russian-developed Sputnik V COVID-19 vaccine. The graph shown represents the standard deviation for Duo Pharma Biotech Berhad. The graph shown represents the covariance for Duo Pharma Biotech Berhad at 10 months of 2021. Let's look about KPJ Healthcare Berhad. KPJ Healthcare Berhad or KPJ or the group is the largest private healthcare provider in Malaysia. The group has been at the forefront of the healthcare business since it opened the first private specialty hospital in Johor in 1981. KPJ integrated network, which include more than 28 specialist hospitals around the country in Malaysia. With its international expansion, the group now has 2 hospitals in Indonesia, a significant stake in a Bangkok hospital, and a hospital in Bangladesh. As the graph shown, which is KPJ Healthcare Berhad, share price seem fluctuate. the company's share price had a upward trendline slope, and the slope keeps showing a rise until the end of October. The graph shown is beta for KPJ Healthcare Berhad, and the trend shown demonstrate the market were highly volatile compared to the overall market, and it has a high rise from August to September and high drop from September to October. The graph shown is represent the standard deviation for KPJ Healthcare Berhad.
IHH Healthcare Berhad is an international private healthcare group that was established in 1974. It is headquartered in Kuala Lumpur and has a wide geographical footprint with 80 hospitals throughout Malaysia, Singapore, Turkey, India, Greater China, and across Asia, Central and Eastern Europe. Among the key people involved is Datuk Muhammad Azlan Hashim as the non-executive chairman and Dr. Kelvin Low as the group managing director. IHH Healthcare Berhad offers a full spectrum of integrated healthcare services from clinics to hospitals to highly specialized care and a wide range of acute medical services that include primary care, secondary and tertiary care, quaternary care, and also complementary ancillary services. IHH Healthcare Berhad's share price demonstrates a steady uptrend movement from 4th January to 30th October 2021. In early January, the share price was dropped from 5 ringgit 61 cent to 5 ringgit 11 cents as there is negative development in private hospitals' involvement in the treatment of COVID-19 patients, prolonged lockdown in Malaysia, India and Turkey, and steep downturn in the regional economies as reported by Affin Huang Research in 25 January 2021. IHH Healthcare Berhad's share price rise drastically on February until October since the private hospital have now accepted COVID-19 patients. According to Free Malaysia Today, government hospital will only refer specific selected COVID-19 patients to private hospitals. If a public patient is instructed to get treatment at the private hospital, the Ministry of Healthcare will bear the cost for all referred patients. Dr. Nur Hisham Abdullah, the Director of General of Health, mentioned that those who qualify as ambassadors, expatriates, and those who can afford the cost of private hospital care, and those who have requested to be moved. Moreover, the pricing framework expected to be similar to other respiratory illness plus additional costs for COVID-19 medications and consumables. Besides, the uptrend was also supported since IHH Healthcare Berhad strongly recovered through easing of travel restrictions and lockdowns by governments resulted to more patients coming in as well as scheduling back previously postponed treatment. The company also took proactive initiatives to partially mitigate the effect of lower patient volumes by improving case mix and by providing COVID-19 screening services. Furthermore, IHH Healthcare Berhad stated that they are committed in support of mass vaccination efforts around the world in assist the various government in administering COVID-19 vaccine to residents through their teams in Malaysia, Singapore, India, Turkey, and Hong Kong. The beta trend of the IHH Healthcare Berhad's share price demonstrates that the market was highly volatile compared to the overall market. The uptrend movement for the first quarter of the year 2021, which are negative 0.3588 and 0.5720 respectively before it drops to 0.0806 on April. The beta tend to rise as the company returned to the black with a net profit of RM 375.62 million ringgit in the first quarter ended March 31st from a net loss of RM 319.78 million ringgit a year ago as reported by MyWinet. Besides, IHH Healthcare Berhad were committed in supporting the government efforts in managing the COVID-19 patient for optimal and timely care. The company has allocated approximately 10% of its bed across its network of 16 hospitals in Malaysia for the treatment of COVID-19 patients. On the second quarter of the year, the beta trend skyrocketed to 1.1342 in May and 3.4832 in June. The edge markets also reported that IHH Healthcare Berhad post a net profit of RM 483.31 million ringgit for the second quarter ended June 30, 2021 versus a net loss of RM 120.64 million ringgit a year earlier. On the back of stronger earnings before interest, tax, depreciations and amortization, quarterly revenue jumped 66.47% to Rm 4.27 billion ringgit as more patients returned to the group's hospital for treatment in some markets due to lockdowns gradually eased in Malaysia, Singapore, India and Turkey. Next, the beta trend declined drastically for 3 months straight until September and shows an inverse proportion to the company's share price before increased slightly in October. The graph shown represents the standard deviation for IHH Healthcare Berhad. The graph shown represents the covariance for IHH Healthcare Berhad. Pharmaniaga Berhad is one of Malaysia's largest integrated pharmaceutical groups that was established in 1994 as Remedy Pharmaceuticals with operation in Malaysia. The company was renamed as Pharmaniaga in August 1998 as the first healthcare company in Malaysia to be listed in the main market of Kuala Lumpur Stock Exchange, now known as Bursa Malaysia. Pharmaniaga Berhad groups focusing on protecting the nation via providing accessible and affordable healthcare solutions. Their business interests range from warehousing and distribution of pharmaceutical and medical products, generic pharmaceuticals manufacturing, marketing and sales, research and development, trading and installation of medical and hospital equipment. With 7 manufacturing plants, Pharmaniaga Berhad are capable of producing products in various forms, from oral solids, liquids and creams to small volume injectable. Their product portfolio encompasses a diverse segment of therapeutic areas such as cardiovascular, anti-diabetic, antibiotics, antivirals, over-the-counter products, and nutraceutical, among others, as well as high-tech European Union certificate plant manufacturers fill and finish Sinovac COVID-19 vaccine. Even though the share price of Pharmaniaga Berhad seems highly volatile, the trend line shows a consistent yet steady slope. On the first quarter year 2021, the share price drops as low as 65 cents and remained consistent for a couple weeks until the third week of April. On May, Pharmaniaga Berhad share price shot up about 40 cents and touched its previous all-time high, Rm 1 ringgit 5 cents for year 2021. The share price rose as investors got more positive on the group's vaccine business outlook amid a spike in COVID-19 cases, as reported by Tan Siu Mong from the Edge Markets. Besides, Gan Huan Wen, analyst from Hong Leong Investment Bank Research, also mentioned that he is positive on Pharmaniaga as he expects the 14 million doses of the fill and finish vaccine to add about 15.5 million ringgit at the group's earning before interest and tax level based on his back of the envelope calculations. Pharmaniaga Berhad share price then drops to 82 cents at the end of July. Malay Mail reported that the share price was declined following the discontinuation of the Sinovac COVID-19 vaccine from China, that Pharmaniaga signed a contract to supply about 12 million doses of the vaccine to the government, and according to the contract, it has to complete the delivery by November this year. However, due to the worsening pandemic situation, delivery of the vaccine would be expedited, said Pharmaniaga Managing Director Datuk Zulkarnain Muhammad Yusof on Wednesday. He said the pharmaceutical company had already delivered 11.5 million doses, or 93% of the promised Sinovac vaccine, comprising 3.6 million doses through fill and finish manufacturing, as well as 7.9 million doses of the finished product that had been imported. On August 2021, the share price was in a sideway between 95 cents to Rm 81 cents. The graph demonstrates Pharmaniaga Berhad's beta trend starting from 4th January 2021 to 30th October 2021, which are highly volatile compared to the overall market. From January to March, the beta for the company is 5.8439, 1.7018 and negative 3.0343 respectively. We can see that the beta was declined corresponding with Pharmaniaga Berhad's share price. According to Kenangan Research, as announced by Pharmaniaga Berhad to Bursa Malaysia, its wholly owned Pharmaniaga Life Science Sendirian Berhad, or known as PLS, has entered into a term sheet agreement with the Government of Malaysia for the purchase and distribution of COVID-19 vaccine developed by Sinovac Life Science and Company Limited, which is the subsidiary of Sinovac Biotech Limited. The agreement enables PLS to supply 12 million doses of finished COVID-19 Coronavac SARS-CoV-2 vaccine inactivated developed by Sinovac. and fill and finish activity NPLS to be delivered to hospitals, clinics and any other facilities nationwide as instructed by Ministry of Health of Malaysia, expected to commence in February 2021. Despite the positive news, Pharma Niaga Berhad's current share price seems to be unattractive and overpriced. The positive near-term prospects, besides the stock lack earnings visibility beyond the interim's extended concession for procurement of drugs from the government, which is to ensure no supply chain disruption in the supply and distribution of medicines nationwide, while an open tender and appointment of a new concessionaire is developed. On second quarter of the year, the beta trend skyrocketed from April to May with beta of negative 0.2861 to 8.5621 respectively. Meanwhile, from June to August, the beta drops to 1.2178 and increased slightly to 2.2231 before continued drops to negative 1.3674. As reported by Tan Siew Mong, the edge market, Pharma Niaga Berhad share price fall as invested with the impact of Malaysia's decision to stop administering the Sinovac COVID-19 vaccine. On September, the beta increased to 2.2974 and then drops to negative 0.2516. The graph shown represents the standard deviation for Pharma Niaga Berhad. The graph shown represents the covariance for Pharma Niaga Berhad.
Apex Healthcare Berhad is a leading healthcare group headquartered in Malaysia, with operating subsidiaries in Malaysia and Singapore and offices in Vietnam and Myanmar. Founded in 1962 as a retail pharmacy in Malacca, its core expertise is in the development, manufacturing, sales and marketing, distribution and wholesaling of pharmaceutical and consumer healthcare products. Key subsidiaries of the group include Malacca-based Zipa Sol Pattinson Malaysia Sdn Berhad, a European Union, EU and Australian Therapeutic Goods Administration GMP certified manufacturer of generic pharmaceuticals, and Apex Pharmacy Marketing Sdn Berhad and Apex Pharma Marketing Private Limited, a pharmaceutical wholesaler and distributors in Malaysia and Singapore respectively. Apex Healthcare Berhad is publicly listed on the main market of Bursa Malaysia. Apex Healthcare Berhad is engaged in the provision of management services. The company operates in three segments, which is manufacturing and marketing, wholesale and distribution, and corporate. The manufacturing and marketing segment is engaged in manufacturing and marketing of pharmaceutical products. The wholesale and distribution segment is engaged in wholesale, marketing and distribution of pharmaceutical, diagnostic and consumer healthcare products. And the corporate segment consists of investment in retail pharmacy, group properties, and brand management contract manufacturing of orthopedic service devices. It provides product dossier and licensing to a range of pharmaceutical products. The company has operations in Malaysia, Singapore, Vietnam, and Myanmar. As shown in the graph, Apex Healthcare Berhad's stock reflects a declining yet steady slope. There is not much fluctuation in share price of the company. This may be due to analysts are placing bets on a number of firms, including Apex Healthcare Berhad, to take part in the wholesale distribution process on behalf of government-supplied vaccine distributors. This is due to the company's extensive distribution network and track record of supplying vaccines and other pharmaceutical items. Other than that, during that time, Bursa Malaysia fell in early Thursday trade on fears about the country's political prospects, while COVID-19 cases soared to a new high amid calls for harsher limits. The FBM KLCI was down 11.8 points or 0.74% to 1,580.17 points in early trade during the first week of the year. Turnover was 970.62 million shares worth Ringgit Malaysia 513.43 million. Decliners outnumber advances 719 to 128, while 304 counters remain steady. As shown in the graph, Apex Healthcare Berhad's stock is much more volatile in January and June against the market. This could be an effect from the news that Apex Healthcare Berhad has been initiated as a buy recommendation by M Investment Bank Berhad. As noted by M Invest, they feel there is room for development in the category, despite the fact that profit contributions remain low at less than 10% due to resurgence in healthcare provider demand and excellent growth in its manufacturing segment. The graph represents the standard deviation for Apex Healthcare Berhad stock that shown the stocks of the company rose from January to March and declined from March to April from 0.0508 to 0.0121. YSP Southeast Asia Holding Berhad is engaged in investment holding and provision of management services. The company operates in three segments: trading, which is engaged in import, export, and trading in various kinds of pharmaceutical, traditional herbal, and veterinary products, and manufacturing, which is engaged in manufacturing of pharmaceutical products, and investment holding, which is engaged in investment holding. Its subsidiaries include YSP Southeast Asia Holding Vietnam Company Limited and YSP Southeast Asia Holding Investment Private Limited, which are engaged in investment holding. YSP Industries Malaysia Sdn Bhd, which is the importer, exporter, and manufacturer of pharmaceutical and veterinary products, pharmaceutical fine chemicals, and provision of management services. And lastly, Yongshin Pharmaceutical Indonesia, which is engaged in trading in various kinds of pharmaceutical products. Since its establishment, YSP Southeast Asia Holding has grown to become one of the innovative and leading pharmaceutical companies in Malaysia. The group became more competent and hence, in 2004, it gained successful listing on the Bursa Malaysia Securities Berhad, Kuala Lumpur Stock Exchange, and later transferred to the main board, which marked a major milestone in YSP Southeast Asia Holding history. Today, the group boasts a wide array of pharmaceutical, over-the-counter, veterinary, and aquatic products, with regional offices as well as strategic alliances in Singapore, Vietnam, Philippines, Myanmar, Cambodia, Thailand, Indonesia, Brunei, Laos, as well as Sri Lanka, Africa, and countries in Middle East. In addition, YSP Southeast Asia Holding have also diversified into traditional herbal products with Son10 Pharmaceutical Company Limited, a renowned GMP manufacturer of standardized and concentrated herbal extracts from Taiwan. There is a significant fluctuation in the share price of YSP Southeast Asia Holding Berhad, as shown in the graph. The share price had a drastic change between February to March and a drastic decline in July to August. The share price of the company, however, had a declining slope of trend line. Shockingly, the company has a long history of paying consistent dividends. The dividend has increased from 0.06 cent ringgit Malaysia in 2011 to 0.08 cents ringgit Malaysia in the most recent annual payment. While the dividend payment are consistent, it is been believed the relatively sluggish rate of growth is less appealing. Shareholders of YSP Southeast Asia Holding Berhad are up to 13% year to date, even including dividends. However, this fell short of the market average. On the plus side, there's still a gain and is better than the average return of 0.9% over the last half decade. This shows that the company's performance may be increasing over time. YSP Southeast Asia Holding Berhad stocks showing an inverse relationship with the market, with January, May, and August have seen the company's stock recorded a beta between 0 and 1, indicates that the company's stock is less volatile than the market. This could be due to company's ability to grow its revenue. Despite a drop in share price over the last 3 years, YSP Southeast Asia Holding Berhad has managed to increase earnings per share by 1.5% every year. This is rather perplexing because it signals that something is temporarily boosting the share price. Alternatively, the firm may have been overhyped in the past, resulting in disappointing growth. It's been noticed that revenue of the company has increased at a 4.3% annual pace over the last 3 years. The company's stock beta did have a huge difference between July and August, but this is because the company announced their dividend on August 21st. The company paid a dividend of 0.08 cents ringgit Malaysia. This indicates that the yearly payout is 3.7% of the current stock price, which is higher than the industry average. The graph represents the standard deviation for YSP Southeast Asia Holding Berhad. The graph represents the covariance for YSP Southeast Asia.
Assalamualaikum warahmatullahi wabarakatuh. Today I will talk about Kotra Industry Berhad. For the company's overview, Kotra Pharma, also known as Kotra Industry, was founded in 1982 with the sole purpose of improving the health of people at all phases of life. Today, Kotra Industries are one of Malaysia's leading pharmaceutical companies listed on the main market of Bursa Malaysia Berhad. For the principal activity, Kotra Pharma offers a wide selection of medicinal items to treat a wide range of illness. As a result, with their preventive healthcare line of vitamins, supplements and immunization, they are especially committed to the prevention of illness. There are three main products for the Kotra Industry Berhad, which is the first one in nutraceutical line, which the main household is Abdin. So the second one is pharmaceutical line, which is AZAM. AZAM line is product specialized in pediatric care, anti-infective, dermatological and gastroenterology, also known as prescription medicine. The third one is also pharmaceutical line, which is BAC5. BAC5 line of product specialized in sterile antibiotic injectable. As you can see, this is the graph of weekly share price of Kotra Industry. For the share price analysis, there is not much fluctuation in share price of the Kotra Industry stock. The slope show a decrease until the end of August and suddenly increase to the end of October. Because of this decline, Kotra Industry share price, they give a buying opportunity for investors following the recent decline in the share price and resilient result in the 8th month of the year. As you can see here, this is the graph of beta of Kotra Industry Berhad. For the beta analysis, Kotra Industries Berhad's beta trend demonstrate the market were highly volatile compared to the overall market. Kotra, as shown in the graph, Kotra Industry Berhad stock is much more volatile in April and September than market. Why I say it's highly volatile? Because there is only 2 or 3 months where the beta is lower than 1.0, while the overall month is show higher than 1.0, so that is why it's highly volatile. Here is the graph show represent the standard deviation for Kotra Industry Berhad. Okay, here you can see graph show represent the covariance for Kotra Industry Berhad. TMC Life Science Berhad. For the company overview, TMC Life Science Berhad, or also known TMCLS in the short form, is one of Malaysia's most rapidly expanding healthcare company. Since 2005, it has been traded on Bursa Malaysia Securities Berhad mains market. The group aspires to be the paid and share preferred healthcare system of choice, providing patient and customer with high quality, value-based care. For the principal activity, the MCLS main activity is to provide exceptional medical service to our patient, to their patient and patrons. There are 4 main hospitals, which is Thomson Hospital Kota Damansara, TMC Fertility, Thomson TCM, and also TMC Care Pharmacy. Here you can see a picture of Thomson Hospital Kota Damansara, TMC Fertility, Thomson TCM, and also TMC Care Pharmacy. Okay, here is the graph for the weekly share price of TNC Life Science Berhad. For the share price analysis, the share price of TNC Life Science Berhad fluctuates. The company share price had a declining trendline slope, and the slope kept showing a decline until the end of October. Here is the graph for the beta of TNC Life Science Berhad. For the beta analysis, TNC Life Science Berhad beta trends demonstrate the market were less volatile compared to the overall market. As the graph shows that the company has reached the highest value for the 10 months on the first month, which is January. A beta of less than 1 means it tends to be less volatile than the market. Here the graph shown represent the standard deviation for the TNC Life Science Berhad. Here you can see that the graph shown represent the covariance for the TMC Life Science Berhad.
Pharmaceutical and health provider risk analysis, economic impact. In 2021, because of pandemic and MCO, there is a decline significantly due to Economic Movement Control Order, which is MCO. Private hospital and clinic have decreased dramatically, and healthcare company cannot operate its business as usual because of that MCO. And rising of living standard, the people have lack of income because have lost their job or business, and they prefer public hospital and clinic. So, what this industry can do? The healthcare company can adopt digital tool and use patient education apps, diagnosis apps, and e-consultation. And pharmaceutical business, they can sell their medicine and product online.
Pharmaceutical are crucial to healthcare system. Pharmaceutical cannot be considered ordinary commodity because they have curative and therapeutic properties. It's often a matter of life and death when it comes to medicine. When institutions are weak and unable to accurately control the pharmaceutical sector, chance for corruption such as fabrication of counterfeit pharmaceutical rise. To educate clinicians on the therapeutic properties of new pharmaceutical, some physician industries interaction is required. Corruption at any of the crucial decision point in the pharmaceutical system can undermine a country's potential to enhance its population health by restricting access to high quality medicine and diminishing the benefit associated with their use. While corruption affects the entire population, the poor are disproportionately affected when officials hoard pharmaceutical or waste resources on the wrong drug. As a result, good governance is must for granting greater access to important medicine. In order to safeguard their citizens from hazardous drug effect, most governments throughout the world set rules on pharmaceutical cooperation. These rules frequently lengthen the times it takes to bring new drugs to market.
Social impact towards healthcare industry refers to social risk that could affect the healthcare industry, especially the healthcare providers and pharmacies. Even though there are a bunch of integrated healthcare services from clinics to hospital to highly specialized care and a wide range of acute medical services provided, people are still inexorable on their belief and naivety towards the effectiveness of traditional treatments. Plus, there are still lack of patients' activation as they are less likely to play an active role in managing their health. Patient activation is vital as it provides self-reported outcomes of one's knowledge, skills, and confidence to manage their health in order to have better health. Across the world, societies still rely on alternative medicines regularly in their life and try to avoid medical care provided either through hospitals or healthcare center, even if they need to. Furthermore, advancements of modern medicines cannot be utilized or at a minimum level as people doesn't aware of the effectiveness and the importance of modern medicines. Even during this COVID-19 pandemic era, where the vaccines are now accessible, there are still people who refuse to get vaccinated because of nonsense excuse. Thus, society still lack of knowledge on the benefits of getting vaccinated. In order to develop patients' activation, patient engagement is essential with a focus on improvement of patients' knowledge regarding self-care and management and shared decision-making. The Affordable Care Act, known as Obamacare, also emphasized patients' engagement and activation, shared decision-making, wellness. Moreover, there are also other barriers that could impact the healthcare industry, which include the uninsured and access to affordable healthcare services and medicines. As reported by Centers for Disease Control and Prevention, in 2017, 4.5% of Americans, more than 13 million patients, failed to obtain needed medical care due to high costs in healthcare. Kaiser Family Foundations also reported that in early 2017, the number of uninsured non-elderly Americans increased for 3 straight years, growing by 2.2 million from 26.7 million in 2016 to 28.8 million in 2019, and the uninsured rate increased from 10% in 2016 to 10.9% in 2019, which include preventive care for chronic disease and major health conditions. In order to overcome it, reduced administrative costs on healthcare facilities is necessary, as it helps to reduce patients' total medical bills, but it will also allow them to allocate those excess costs to medicines and other aftercare expenses. Last but not least, people should take advantage of today's innovative technology through telehealth, which is more cheaper than walk-in consultations. Nowadays, some medical professionals also have been using telemedicine with their patients that been offered at no additional cost to the uninsured and also on a sliding scale. Telehealth is also cost effective in some cases compared to traditional healthcare, especially in transportation or mobility issues are at play. Telemedicine may be a more cost positive manner of treatment.
The health impacts of environmental change are now squarely on the radar. Spillover of the virus causing the COVID-19 pandemic from animals to humans is one glaring example. But less is known about the reverse environmental harms from healthcare. It has also been found that the healthcare sector causes a substantial share of the world's emission of greenhouse gases and air pollutants. 4.4% of greenhouse gases, 2.8% of harmful particulate matter, such as air particles, 3.4% of nitrogen oxides, and 3.6% of sulfur dioxide. Depending on the measure, healthcare has an environmental effects that range from 1% to 5% of total world impacts. At the individual country level, it contributes more than 5% to various indices. Previous studies estimated that health sector greenhouse gas emissions for the United Kingdom and Australia represent 3% to 4% and 7% of national emissions, respectively. In the United States, that figure comes closer to 10%. Pollution from healthcare sector can take many forms. Hospitals and pharmaceutical companies are the largest drivers of emissions. For example, along with its contribution to greenhouse gases and air pollutants, healthcare uses 1.5% of scarce water in the world. Scarce water is measured as water consumption weighted by a scarcity index, which takes into account insufficient access to clean water in different countries. For example, in South Korea, emissions of greenhouse gases, sulfur dioxide, nitrogen oxides, and particulate matter from healthcare decreased by between 27% and 60% during 2000 and 2015, whereas in China, sulfur dioxide, nitrogen oxides, and particulate matter from healthcare increased by between 91% and 173% in the same period. With the increase in the new cases almost every day and the number of tests being done, the amount of clinical waste seems to be increasing. In Malaysia alone, a 27% increase in clinical waste is reported by the Ministry of Health following the COVID-19 outbreak. The increase is mainly attributed to the increased usage of disposable gloves, face masks, and personal protective equipment (PPE) by the medical staffs. Unlike many business corporations held accountable by their boards to produce profit, medical institutions are accountable for the health of their communities. There's been a groundswell of desire from healthcare workers across the country who want to see the industry operating more sustainably. To move forward in reducing the environmental footprint of the health sector, provincial governments could introduce mandates encouraging hospitals to become more environmentally friendly.
The conclusion is the COVID-19 pandemic is wreaking havoc on health market, particularly the pharmaceutical industry, and identifying these consequences will help policymakers devise better evidence-based plan to address the issue that come with it. However, because biopharmaceutical are increasingly dominating drug development pipelines, we may be confident that the future generation of human pharmaceutical will leave considerably fewer residues in the environment than existing medicine.